welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today, in the middle of the busy holiday season, we are going to take some time to talk to you about your health and your health care, because there's a deadline that you need to know about. And here to tell you about it is our friend Gaylene Kanoyton. Welcome back, Gaylene.
Thank you so much for having me.
Healthcare is crucial to people, and we have some big news this year that people can get coverage even if they couldn't before, and it may be free, and that is huge. So tell us what is going on with the healthcare marketplace right now.
Well, you know, Robin, this is my 5th year in doing Enroll Fest, and we enroll people into the health insurance marketplace, and we're excited.
Which is, let's just be honest, everyone calls it Obamacare.
Obamacare, yes.
Not the formal name, but just so people know what we're talking
or the
about.
Affordable Care Act.
Right.
But we're excited that now, when people come to our enrollment events, we don't have to turn really anyone away. Before, we had people to come and they fell into the gap, which means they made too much money to get into Medicaid or weren't eligible, or they didn't make enough to get a government subsidy into what you call Obamacare.
Right.
So now, with Medicaid expansion being passed.
In Virginia, because it was in many other states originally, but many of the southern states were not on the bandwagon right off the bat.
That's exactly right. But now that we have it expanded in Virginia, now an individual who with no children, who weren't able to get Medicaid before, now can get Medicaid. You don't even have to have a job. You can get Medicaid. Then a family of 3, if you had a family of 3 that say the family made something like $28,677 and under, now can get Medicaid. You know, and let me just backtrack. If an individual makes $16,754 and under, they can get Medicaid. Before, they weren't eligible to get Medicaid.
All. No way.
And a family of 3 had to make under $6,900. Now it's $28,677 and under, and they can get Medicaid.
So my concern is that what's happened to people who have been unable to find full-time employment. So maybe they work at a restaurant or retail, they're only able to get part-time hours, they signed up for Obamacare once before and didn't get the subsidy, and so the amount was just crazy high.
That's exactly
and
right.
They've given up. Mm-hmm. So how do you get them back in and say, hey, you can get something now. There is a plan, it's out there for you. How do we get them?
We're using social media. We're talking to business owners, fast food restaurant chains. I mean, I've had owners of fast food restaurant chains call me up and say, look, my people won't enroll because they don't believe it.
Right.
You know? And so he was like, I need you to come in and talk to them, or bring in your team and talk to them and get them enrolled. So we're using all kinds of mechanisms. But let me tell you, once a person gets enrolled, they tell all of their friends. Mm-hmm. So the word of mouth really works.
Okay, it is also easier, and I will say I've gone online with a friend and have done it, but it's much easier when you're holding my hand.
That's exactly right. That's exactly right.
So tell us about Enroll Fest that you have coming up.
Right, so we have several Enroll Fests coming up, but the major one is going to be the Health Insurance Marketplace Mega Enroll Fest, and that's going to be Friday, December 14th, and Saturday, December 15th at the Hampton Roads Convention Center. And we're excited about that because not only will we'll be able to provide in-person assistance into the health insurance marketplace, Obamacare, also into Medicaid. Social services will be there, and there'll be all kinds of assisters that'll be able to help people.
Like literally sit down beside you. Now, if you have a password, you need to know it. That's a little trick there. If you've tried before.
On the marketplace side.
On the marketplace side, or you know, whatever, you have to sign in. But someone will help you do it. And even if it's not really that hard, but just having somebody sit with you and answer your questions, it just makes it a lot less scary and intimidating.
Well, we have a trusted insurance agent that helps us, and that's Town Insurance. So you don't really need to have a password. They'll walk you through everything you need to do. They've been working with us for 5 years, so they'll be there. Like I said, social services will be there to help with Medicaid, to get people enrolled in Medicaid as well, and we'll have other assisters there. But I'm really excited that we're going to to have a job fair and a job resource fair, and we're going to have the Hampton Roads Workforce Council as our partners in this that will help people get ready for job readiness, see what resources out there to find a job, training, and we'll have employers there to actually be hiring as well too. You know, there will be a work requirement towards maybe the end of 2019. We're not sure yet, but it's not now. So we don't want to discourage anyone from not enrolling. You know, enroll, get into Medicaid or get into your into the marketplace. You can now get insurance, which will help you get your physical, mammograms, colonoscopies, all of your preventative care at no charge. You have no excuse not to go to the doctor anymore.
It makes so much sense, and it saves individuals in the long run. It saves on cost in the long run. The healthier you are, the more able you would be to get a job, the more you can do in your personal life. It's a
everything.
Huge change.
Virginia
Right.
has a wonderful website that's coverva.org, where you can find out anything you need to know about Medicaid, and that's coverva.org. And then you have your health insurance marketplace, which is healthcare.gov. But I tell everyone, go visit coverva.org, because everything is there. And my website is celebratehealthcare.net. So you can go to these sites and you can get all the information that you need. And you can actually enroll in Medicaid over the phone. You don't have to do it online. I mean, you can call, which is 1-855-242-8282. You know, that's so easy. You can call them right up. The number's on coverva.org, and they'll take your application right over the phone.
Now, everything has a different deadline, which I find really confusing. First of all, Medicaid doesn't have a deadline.
It's
you can enroll
all
at
year
any point.
round. That's right. It's all year round.
But the sooner the better, because the sooner you enroll, the sooner your coverage starts.
January 1st. If you enroll, that's we want everyone to enroll as soon as possible so their coverage will be able to start January 1st. I think it's somewhere around 40 days, 35 to 45 days for them to, get approval and turnaround time. So you want to get it done early so your insurance can start earlier. January 1st is the start time for your marketplace insurance and for your Medicaid insurance.
Okay. And I'm going to keep calling it Obamacare because that's what I know. Healthcare Act, what do you call it?
Yeah,
Affordable Healthcare
so
ACA.
we'll call it the Health Insurance Marketplace.
Yeah,
and
that has a hard deadline.
That's December 15th. And we're telling everyone that if you already enrolled into a plan, go back in and make sure that's the plan you want. Things change. We've got some additional carriers in the area now. So
Things change, costs change.
Costs change. Your income might have changed. So you could either call healthcare.gov at 1-800-318-2596 or visit healthcare.gov and talk to them and see what you're eligible for. You don't want to be automatic renewed. You want to make sure that you got the best insurance for yourself. And the same with Medicaid. If you were in the marketplace and you start making a lower amount where you couldn't get a government subsidy and you're eligible for Medicaid, you need to cancel your healthcare.gov.
Or you're going to auto-renew.
You're going to auto-renew. And then you can apply for your Medicaid, but you got to make sure you cancel that healthcare.gov if you're eligible for Medicaid.
I didn't think about that. Are we seeing, you hear these crazy stories about people in the healthcare marketplace whose premiums have just shot through the roof or only have the choice of one plan. And a lot of times that's in highly regulated states or very rural areas where there aren't as many choices. Are we seeing that here in Hampton Roads?
Yes, I mean, the insurance companies, they really don't have a cap, it seems like, anymore or whatever. So employers are having to pay more for their insurance now. And now I'm not sure if they pass on some of the discounts they're supposed to receive onto their employees or not. But I do know that we are our brother's keeper. We are our sister's keeper. So the less fortunate now can get insurance. And then you also have your middle income and to low income. They all can get insurance now. So, we have a healthier society now.
We're not seeing providers and insurance companies drop out of the Affordable Care Act plans, like in some places.
Well, this year, 2018, we only had Optima in the Affordable Care, which is the health insurance marketplace.
Okay.
Obamacare. Okay, but now we have Anthem and we have Optima.
So
now.
people have choices for next year that they didn't have. So people really should go look.
And that's it. But however, in Medicaid, you have 6 carriers. Yes, you have 6 carriers of Medicaid.
Oh.
So it's all of your Anthem, your United Health, your
This is very
Premier, Virginia Premier,
confusing.
whatever. Yes, it is.
Just one more reason to go to your event.
Yes, come to my event at the Hampton Roads Convention Center. We'll be there December 14th from 10 a.m. to 6 p.m. And on Saturday, we'll be there from 10 a.m. to 4 p.m. on December the 15th. Now, if you miss those days and you want to enroll in the health insurance marketplace, you have until 12 midnight on December 15th to enroll into a plan, and you can do that right online at healthcare.gov.
And that's it, unless your circumstances change.
Exactly.
If you lose a job, if you
Special enrollment.
get married, if you get, something happens in your life that's
Have a life change. You can do special
But
enrollment.
that's the only
into it.
reason.
But Medicaid is all
Anytime.
year round. It's anytime.
Now, there's been a study that says how many people in Hampton are potentially eligible for this expanded Medicaid. How many is that?
About 5,200.
That's a lot of folks.
That's what we know. We think it's more. I mean, you have Hampton Roads have a high number of people that fall into that category for Medicaid expansion, and so we know the numbers are higher. But we have the numbers, but for Hampton it's 5,200, and so we know that is a lot.
Can you imagine that?
I can't.
5,000 people in our community that could have health insurance that could have health care, paid health care after
right.
January 1.
That's right. You can look at your homeless community, just different communities, your unemployed community. They all
This
can
covers
have it.
things like mental health and substance abuse too.
Everything, yes, it
People
does.
who could deal with chronic conditions in a way that they have not been able to.
Exactly, and so
That's community changing.
look, in the long run, we may not see it in our lifetime, but we'll have a healthier society. You have more younger people now that are coming to get enrolled. Last year, even though the insurance went higher, the government subsidies doubled too. So we had young people and people that were coming in that were paying maybe $3 a month into the marketplace for a month for their insurance, or paying $0 a month for their insurance in the marketplace, and just different rates. It was so low that they were getting it. I mean, one quick story I want to tell you is a lady came in. Her husband had just retired and he was eligible for Medicare. She wasn't old enough to be on Medicare. And when she enrolled into the marketplace, she broke down and cried. And I asked her, "Why are you crying?" She said, "Because," and she told me the story that her husband was on Medicare and she couldn't be on there. She was an epileptic, a diabetic, and she had all these diseases. And her prescriptions was $911 a month. Well, guess what? She signed up and enrolled for $13.18 a month, and her prescriptions were included. Those are the stories that we hear. I know it's breathtaking, but we hear all kinds of stories. I mean, over the media, you might hear that it costs too much and this and the other. But the health insurance marketplace and Medicaid will help so many people that normally didn't have health insurance before. They no longer have to use the emergency room as their doctor's office anymore, because only people will go to the doctor when they go to the emergency.
Right.
And we tell young people, you pay $3 a month, you pay $20 a month, $50 a month, whatever it is, it's still going to be much lower than if you would get into a car accident or something and go to the emergency room and have to pay thousands and thousands of dollars.
Right.
When you'll be able to get some type of percentage off of it because you have health insurance.
And if you treat something when it's small instead of waiting until it gets big and it is an emergency case, it makes so much more sense.
It does. And we have, and I love having our Enroll Fest at the Hampton Roads Convention Center, because I can tell you how many of the grandmothers bring their grandkids in to make sure they get enrolled. So they bring them in by the ear to make sure they get enrolled. But once they get enrolled, and I have a Facebook page, Celebrate Healthcare, and I actually have videos on there where you can see after people have gotten enrolled, they'll do their testimony, and I'll put it on Facebook Live, because I want people to realize this is really real.
These are real people.
It's real. These are real people. And we have citizens that would come on there, and especially young men, they said they never thought about getting insurance
No,
before.
they think they're healthy.
You know,
they think nothing is ever going to happen
exactly.
to them.
Nothing's ever going to happen to them. And now they can go and they can go at a low cost and get all of their preventative care at no charge.
Right. And that decreases the chance that something will happen to them because they've had the preventative care.
Exactly, because the earlier detection, the better it's going to be in the long run. And we've had many women that come to us who was able to go get a mammogram, and they caught a breast cancer at a very early stages, or something that might look like it. They were able to catch it because they were able to get a mammogram.
Makes a big difference.
It does.
Well, thank you so much. Thank you for the work you do.
Thank you. I appreciate it.
And thank you for watching. I hope that if you don't have health coverage now, or if you have health coverage and you want to check what you have, see if there's something else out there that might be better, you will come on December 14th or December 15th. Maybe look at some job options while you're there, because as you upgrade your health, you can look to upgrade your job skills as well. But make sure if you are employed and not covered that you hit that December 15th deadline to look at the healthcare marketplace. Make sure you have coverage. And if you've been in that gap area before and their subsidy wasn't there, step out this year, look and see if you can get Medicaid, because there's a really good chance you could have health insurance. And go to Gaylene's website if you have any questions at all. Thanks for watching.